very well pleased to welcome to the stage Professor Inga Dóra Sigfúsdóttir from the University of Reykjavik. Please, you're welcome.
Dear colleagues, the year is 1997. It's a Saturday night in June. The clock is 3 a.m., so don't be fooled by the daylight. It's an Icelandic summer night. Downtown Reykjavik is full of adolescents, intoxicated adolescents. At the time, over 40% of Icelandic adolescents have become drunk in the past 30 days. 20 years later, in January 2017, Iceland makes the headlines in the world news. Iceland seems to have cracked the puzzle how to get kids, adolescents, not to use drugs. So what happened in between those two time points? So here, I'm not going to talk so much about improving healthcare, although that says so in the agenda, but improving health, decreasing the need for healthcare, and creating quality lives for young people. The story that I'm going to tell you starts in 1997. 42% of 15-year-olds have become drunk in the past 30 days. 23% are daily smokers. 17% have used hashish once or more in their lives. And I tell you, it was not that nothing was being done. There were all kinds of, or numerous prevention programs being carried out, most of them focusing on educating adolescents about the negative sides of substance use, all having one thing in common: they were not based on data. None of them using research as a base for the work. And things were not right. Alcohol use, smoking, and use of other drugs was constantly increasing among adolescents. So we obviously needed a new strategy. At the time, a visionary group of researchers, policymakers, and practitioners working with children and adolescents decided to gather their strengths, try out a new approach, and see if we could reverse this negative trend. The project was and is called Youth in Iceland. It has 3 key elements: evidence, first and foremost, to know where we're heading, we know where we're standing. And no less, we need to understand what predicts adolescent substance use if we're going to affect it. The second core element was using a community-based approach, focusing on changing the social circumstances of young people within each community, neighborhood, city, not trying to fix all at once in a country, but creating circumstances in each community, each city. The third key factor was to create a dialogue between research, policy, and practice, getting each of these valuable parts out of their comfort zones and into a dialogue. We wanted to change what we thought looked too much like this, where research, policy, and practice are 3 separate aspects, with scientists publishing their findings, not knowing, and often not caring whether they come of any use in society. Into this, where people combine their efforts and knowledge to create a system that would benefit young people. So first and foremost, we needed to understand what indeed we were dealing with. We started carrying out studies of young people, and it is fun to live in Iceland as a scientist. because you do not need to sample. You just go out and ask everyone in the cohort. Approximately 4,000 adolescents times X, depending on how many cohorts we're studying at the time. And we carried out surveys, theory-based surveys on numerous things. We want to believe all things in the lives of young people. And we studied and learned a lot. For example, that Icelandic adolescents, along with their Scandinavian and British peers, consumed alcohol differently than other European teenagers. Whereas 1, 2, or 3% of 15-year-olds in Southern Europe had become drunk, the proportion among their Icelandic peers was over 20%. Similarly, unwelcome incidents like accidents and injuries related to alcohol consumptions were more common in Iceland than in other European countries. A part of the explanation was a very liberal view towards adolescent drinking that was here in Iceland and needed to be changed. We also learned that variations in substance use follow cohorts. So substance use can be predicted. The message to policymakers, we need to reach them young, and we need to reach them before they take their first drink, and reach the parents of young kids. We analyzed the risk and protective factors. The studies revealed that affiliations with family, peer group effects, and types of recreational activities available are the strongest predictors of the path taken by adolescents. So a strong link between having friends that drink, smoke, or use other drugs and doing so yourself. A strong link between 3 key things within families: emotional support, positive monitoring, and the quantity of time spent with parents, not the quality time necessarily that we had liked to believe, because we didn't want to spend too much time with them. It turned out that we need to spend time with them. And organized work, participation in sport, and other organized work decreases the likelihood of substance use. All these findings and more were used as a foundation for a comprehensive prevention program that consisted of multiple small and large-scale projects on different levels of society, targeting these core factors. So we never talked about substance use. We targeted the mediating variables. By putting less emphasis on education about substance use or teaching individuals to say no to drugs, but instead focusing on changing the social environment of youth, and through that, affecting their behavior. Not only attitudes, because attitudes and behavior do not necessarily go together for this age group. They may think it's very negative to smoke, but they do it anyway. NGOs were formed. Their efforts sought to promote collaboration between parents and schools, encourage parents to spend more time with their kids. The focus was on reaching out to parents with clear messages from the findings of the studies. For example, on the importance of spending time together, that all teenagers should be home by 10 o'clock in the evenings, and that unsupervised adolescent gatherings should be avoided. At the neighborhood level, an example of a project was Parental Watch, where parents formed groups during weekend nights and took walks around neighborhoods, sort of in a friendly way, to monitor the behavior of youngsters and also to get to know each other. At a community level, participation in organized work was encouraged, specifically by offering adolescents prepaid leisure cards to partake in structured activities. And at the national level, media campaigns were launched. And there, as always, it was stressed that every stakeholder in adolescents' lives, parents, teachers, coaches, cops need to work together in order to succeed in fighting substance use. And the tide began to turn. Adolescents started spending more time with their parents, both on weekends and weekdays. Monitoring by parents increased. Adolescents started coming home earlier in the evenings, and they are getting more support from their parents. Likewise, participation in organized work increased, and unsupervised gatherings were less frequent than before. And substance use declined. So now we're here with 5% of adolescents having become drunk in the past 30 days. And when our colleagues, because these are our neighboring, these are collaborative cities in Europe, they say that the reason, of course, is you're also strains up there, up north. It's an island and you're so few. We tell them this. So this is us in 1998. So for the past few years, because when things in 2006 were showing such a good success, we were asked, why or what are you doing? So we've had an opportunity to work with colleagues in several cities in Europe through what we now call Youth in Europe program, not Youth in Iceland, where we're figuring out whether we can make similar principles work in different locations, creating circumstances that may influence the lives of adolescents in a positive way. And it turns out that the model is easily transferable. So where we start working, a few years later, we start seeing the same results. So dear colleagues, today our work is a joint European effort. We would like it to become a global effort in a world where there practically are no boundaries anymore, no cultural, no national boundaries, and cyberspace is without limits. Teenagers are mobile in more than one sense of the word. In this kind of world, we know it's only through joining forces, by learning from each other, and basing our work on trustworthy research that we can fight substance use. It is not an easy task, but based on studies, we know it can be done, not through single project solutions, not one campaign, but more as an evidence-based, action-oriented revolution. Thank you.
Thank you, Inga Dóra. What a great story. Please come and join me on the sofa, and John, please come on up. Yeah, grab a seat on the sofa. That'd be great. I'll come at the end. That great story. Love this case study. I was in a past life I worked in the British government, and I remember we were looking at politicians concerned about knife crime. It turned out a whole bunch of research and evidence had been done about knife crime, and I said, well, how well done, how fantastic that we're ahead of the game with this research and data. And the analyst said, well, actually, 3 years ago the politicians were concerned about gun crime, and we did research. We told them that knife crime was the way into gun crime, so we did the research then. And it's so hard to do evidence-based policy making because it takes kind of patience to actually build up that time. So many thoughts there. Let me go first to the audience. Who's got a question? Who wants to raise something? Sir, Fernando.
Hello. Good morning. My name is Fernando D'Alessio. I am coming from Lima, Peru. I am the Dean of the Catholic University Business School. Peru is 30 million inhabitants, and we have coast, mountains, and Amazonas jungle. Congratulations, 2 great speeches. My question goes to the technological one. How can you approach the 2 billion people in the world in the bottom of the pyramid that makes $1 a day. You have to go to those places to meet people. And how can I provide them an iPhone and an iWatch to check their health? It's not an easy task. In the case of drugs, I cannot say so, because if Peruvian people has no money to buy drugs, then that is, we have that aside. I would like your comments about that. Thank you.
Please. John.
Yeah, I mean, that's the right question. So I use the Apple stuff mainly because I actually have data out of it. We've just launched our first studies on Android, which is really where we're starting to go. And at least in the US, we're looking at feature phones that are $20 US or less. And we see the cost of those dropping pretty radically. But I think that over the long term, there have to be clinical protocol designs that take into account that you may have one phone for an entire village. Or that you may not have phones available, but you have the phones in the hands of someone who goes to the village and does the research. And I think it's one of the reasons why we have to be focusing on the politics of this from the beginning, because if we simply focus on people who can afford new phones, this is just going to replicate the power structures that exclude people from clinical research. The first of the international studies around this are just getting started. This has been about 2 years. When we started this 2 years ago, the sense was that doing this was impossible to do it ethically, and if you could, it wouldn't work scientifically. And I think from your talk, one of the things I try to tell people is when you do clinical research, it's like agriculture. You have to think like a farmer. And so the first set of crops are just coming up now where we can say that these are good crops and they feed people. And now the question is, how do we get these crops to the world? So that's something that we spend a lot of time thinking about. I spend a lot of time thinking about. The best answer that we have right now is that this has to get to the most basic phones in the world as quickly as possible, because the penetration of mobile devices across an enormous economic range is pretty stunning. And if you remember yesterday from the talk on internet access as a human right, I think pretty soon having a device that connects you needs to be thought of as a human right. And that's when we can start to have this conversation, I think, in a more equitable way that addresses your question.
Right. I think it's connected with what Carolina was saying yesterday about the scope by which we can actually spread this and all the positive externalities of being connected in that way if we get it right. And I think also this connects the conversation we're having later about scaling. Inga Dóra, Fernando is relaxed about substance abuse because people don't have money to pay for drugs. What do you think?
Well, that's very interesting. You have a very interesting situation in your place. In most of the places, poor places where we are working, they don't necessarily buy it, they grow it. So I don't know. So you're very lucky. You obviously have a very good situation.
Beware. Right. Now, please, Julie, and then I've got one on the back there, and over here.
Thanks. So I just heard a report about something called Cloudy with a Chance of Pain, which is a research project, I guess you'd call it, trial, that's being done in the UK about the effects of weather on arthritis pain and similar pain, which is using a smartphone to combine how people feel with the GPS recordings about where they are in the weather. And it involved 13,000 people and over 5 million reports that they sent in and the like. I'm curious as to how you think this kind of citizen science type experiment is going to work and how you see that field evolving in the context of collecting this kind of data.
Let's collect a few of these questions. In the corner, is that Marcelo? And then we've got one here. Who else wants to come in? And here, Nigel.
Thank you, Marcelo from SPI in South America. It's kind of embarrassing question, but we do for our research all the time. It's about the bias in the bias in the selection, like for teenagers answering if they drink alcohol or not. In this recent years, I just would like to know how do you treated it, how do you work with the bias, and also if some other economic factors may have affected this increase, not like a marginal effect on that. Thank you.
Cool, thank you. And then over here, I think, we had a question here, and then we had Nigel here, and that's probably the last one, and I'll come back to you.
My name is Kristín Vala Ragnarsdóttir from the University of Iceland. There's now more and more scientific evidence how being out in nature is important for health. Not only being out there, but this would be the ecosystem services that nature gives us, but also the sort of organic molecules coming from the soil and the tree leaves and so on actually has a physical effect on us, improving serotonin production, improving our immune system and so on. Are you including that in your studies?
Thank you. And then final one here.
Nigel Kershaw, Chair of the Big Issue Group. Actually, it's a bit wider. It's about the innovation in technology and data. And it was really interesting. I was reading, I think last week, 1981, Sherwin Rosen, an economist who wrote something called The Economics of Superstars, which was this really very simple thing, that the more disruptive the technology, the more concentrated the power. And I think we're just seeing that again. So really it's a question about innovation and concentration of power, which I think you started to address.
Thank you. John, will we go first?
Sure, so I'll go to the weather, and then I'll go to Nigel's comment, because I think we can leave the middle ones. Although I can talk a little bit about the last one. So the GPS is a really interesting data point, because it's really one of the easiest things to get off of phones, no matter whether it's a modern iPhone or another, a very early stage flip phone or a candy bar, because you can get that from the cell towers, right? You can figure out location. And so things like barometric pressure are very easy to cross-reference to your cell phone tower and your timestamp. And so we're looking at a barometric pressure headache study similarly. And so from the question really, again, it goes back to the politics. I mean, I started my career 20 plus years ago in politics. I think almost everything is about power and politics. And so it's one kind of study if the 13,000 citizen scientists are truly citizens and have a set of rights. It is very different if those 13,000 people are users who sign a set of terms of service that govern them in a way that is opaque, enforced through a process where you don't have rights of petition, injunction, and viewing. And so citizen science to me is a very important term to protect, because if we let us be called users and consumers in health, then we'll be treated as people to whom products are marketed, not to participants inside a body politic. So I think, and this is a bit to the last question as well, which is, I think the reality is that a disruptive technology comes out, it's adopted by those with the resources and the cultural and the knowledge backgrounds to exploit it. Those people can start businesses around that technology. The users of the data that they create, right, it creates this network effect that leads pretty quickly to monopoly and oligopoly, right? That's what we see, at least in where we are, is we have these systems that evolve really, really, really quickly to oligopoly and monopoly. And what I like about working in health compared to working in other kinds of technology is that we at least do have an international consensus on human rights. We have an international consensus on bioethics that has come out of Nuremberg, that has come out of international atrocities in health research. And so that's actually something that, and then the regulatory regime around it is something that people have critiqued, because it's prevented disruptive breakthroughs in health technology. And I see that and I understand it, but in a strange way, it's also protected health to allow us to do some things that are politically oriented and have a human rights framework that we might not have had an opportunity to do otherwise. So my hope is that if we can demonstrate that you can have the disruption and the innovation and political context in health, then why can't we have that outside of health? So that's my hope, at least.
Cool. Thank you. Inga Dóra, if you take the first two, the middle two, I'd also love to hear your views on citizen science as well. But
Okay, so your question was twofold. First, to whether we know whether what we've been doing is working. 10 years back, I would not have sat here and telling you this story. We have studied so we've published numerous papers on exactly this model. And I tell you a few things. We see that Icelandic adolescents moved in ranking with their European colleagues, so that Iceland was the only country out of 20 in the ASPET study to show a constant decrease in substance use throughout this period. We had a chance, although at the start we didn't like it, we had a chance to study the communities that took part, comparing them to the ones that didn't. And we saw quite a lot of difference, because at the start we of course wanted everyone to take part, but later on it became an opportunity to study the difference between these communities. Several other things we have published on this. We also see that when using the same methodology in Kaunas, in Lithuania, in Riga, in Latvia, in other places, we get the same results. So we have published a lot of papers just on whether this is working, and we say now, yes, we know this is working. But it takes time, and we started 20 years ago. And we just started farming, and we seem now to be able to see that this is working. The other question that you asked was about whether they are telling the truth. The wonderful thing about working with young people is twofold. They're very honest. We see that approximately 1 to 1.5% do not tell the truth, but they are extremely honest, they're very accurate, and they're very interested in themselves. So having them fill out a survey about their lives, and it's the best age group, 10 to 20 years old. So we ask many questions. We never ask one question about one concept. And we ask them whether they have used drugs that do not exist. So if they fill out everything, we've done everything 40 times and more, we take out these questionnaires. So we thoroughly go through it.
And the environment?
As regards the environment, exercising, being out in the environment, I think, there are many things that we still do not understand. Running outside is, yes, it will benefit. We see that. But we have studied whether it is the organization of whether the organized youth work is a key, or whether it's just like moving, like running. And we see that the organization for this age group is very important.
Thank you very much. Ladies and gentlemen, please join me in thanking Inga Dóra and John.
Thanks.
Great, thank you.